It's pretty wild that HIPAA threw their hat in with, for hymns and HelloFresh and all this other bullshit.
Excuse me?
Wait, what?
Oh, it's our sponsor. Yeah. Brought to you by HIPAA. Yeah. Until we can get that real sponsor
What's
money.
for hymns?
It's like male enhancement sort of shit.
Oh,
but
like the gas
natural or
station? Natural.
Like get some motherfucking Blue Chew.
something. Yeah.
By natural, do you mean blood? Because that's
don't know.
usually the cause of an erection.
I don't.
It's just blood.
It's just a vial full of.
I really got
Full
you.
of- It's just a vial full of penile sponge. Is all it really is.
Episode 10, recorded September 23rd, 2021. I mean,
Listen, a work spouse is a very normal thing for a hospital. One of my work wives is Nikki. I have lots of work wives too.
The work harem.
Nikki, Paola.
Are there any? Do you have any close male? Are you allowed to have more than one? Do you have more than one male work spouse?
No.
So you have a monogamous.
But I do think that there might be male nurses working there that might claim me as a work spouse, but I don't want them.
Well, I'd like to introduce everyone to my actual spouse, my spouse, my home spouse, my wife's spouse, my legal spouse. That's Allison right there, the one who has the work spousal harem going on.
Well, the reason that I have work spouses and the reason that all nurses and healthcare providers like us have work spouses is because we're actively going through trauma together, and sometimes you bond, you trauma bond.
I mean, I feel like Robert and I have been through a lot of trauma together, and I've never once felt like, you know what, we need to make this matrimonial.
But what I am hearing is that if I'm interested in engaging in marriage, that I need to engage in trauma first.
No, just
Yeah, is that the basis of our marriage?
no.
Is that the
What the
prerequisite?
fuck? Like, we went through trauma outside of work, so you get to
Extramarital trauma.
Yeah,
What-
you get to keep the cow. You know.
What I mean by that is that, like, when you go through trauma together in a hospital setting, you bond really quickly with people. Like, it doesn't the spousal stuff is more just like a funny, lighthearted, like superficial joke. But going through trauma together, like you guys have seen shit together like immediately. So you're like, yeah, we're friends now. Like,
Yeah, and so there's not a nice word in between friend and spouse. That like there's not a nice word
because it's not like I'm not friends with them outside of work.
Right. I'm trying to make a legitimate like observation
okay.
here. I'm not trying to give you shit, but like there's not a good word in between friend and spouse that sort of indicates this, like, we're friends, but we've been through the shit and we're really fucking bonded.
Yeah.
You know, there's not a good word
Because
for
we're
that.
not besties.
No,
It's just,
I don't
you know.
call them when I'm not there. I don't need to see, like, I've had enough. But once I, like when
Much like marriage.
But when I see them at work, I'm like, thank goodness you're here. I trust you.
Yeah.
Like, you develop, you can walk into a room with 10 strangers, run a code, and walk out with 5 best friends and 5 people that you never want to talk to again. Because you either...
Right. So, yeah, because you know, and I guess that's kind of like, that sort of seems as I hear you talk about your job a lot, that there's not a lot of time for catty bullshit and politics because y'all are having to actually do things. So
Right. I've said the sentence out loud. Don't be a dick. This guy's dying and we need to work faster. Like, that's...
Right. And I, as someone who worked in sort of, high school education and college, higher education as well, and that nothing we're doing is ever that urgent. So there's always time for bullshit.
For, like, cattiness or
Yeah, I think there's
gossip.
There's this quote that I heard that the reason that the knives that in academia, the reason that the knives, oh my God, it's a really complicated quote. Hold on, give me a second. So in academia, the reason that the knives that stab you in the back are so sharp is because the stakes are so low. Is like the idea.
The stakes are
So low.
low.
Yeah, because nothing's fucking happening. You're not saving anyone's life, you know. But like the competition, but who gets to be?
I thought it was supposed to
on-
be a play on word with like a meat steak.
Wrong steak. Wrong steak. But yeah. Anyway, you don't work.
So people have more time to sharpen the knives.
Yeah.
When they do the stabbing.
Yeah.
Yeah. Our
Okay,
knives are
got
like
it.
paper plates. We don't have time for that.
Yeah. Y'all are, you know, because while you're busy being mad at somebody, someone else is actively trying to die, and I really need you
Like,
to
I-
hold this person's brains inside of their head.
Like, I hate you, but I need your help. Get in here and do something.
Right, and so few of us have the opportunity to have that gift of an experience of I
It
hate you, but I need your help.
It is kind of unique because at the end of the day, you're all trying to accomplish the same goal. We are trying to keep people alive. So it's just the truth of it is, and for it to be a little more serious, the truth of it is that you just get to. You feel really comfortable with people really quickly because you're going through, even pre-COVID, like when you care for people that are dying together, you bond, and it's just, for whatever reason, it's just really easy to be like, well, let me tell you my entire life story. And you will tell secrets to people, especially when you work on night shift, because you get really punchy. Like, you will tell secrets to people that you would never tell ever to anyone, but you'll tell them to this person you've worked with for 6 hours. And then leave feeling like you have a new best friend, and then you won't see them again for like 8 days. And then you see them at work again, and like everything's just normal. I don't know.
Wow.
It seems like there's also kind of there's a permission to get close in a way, because they're gonna fucking go away. Like, you're gonna, you know,
Right.
like,
You get to leave, and you get to go back to your like normal lives. And like, you're there for 12 or 13 hours. So like, sometimes you're just like, hey, I gotta go take a shit. I'll be right back. Like, nobody cares. Like, everyone has to poop sometime in 13 hours. Like, there's not a lot of privacy. There's not time to yourself. You all eat together.
Y'all don't have the luxury to care about that kind of stuff.
No.
yeah.
And I kind of like it. Kind of breaks down the walls of people really quickly, and you get to know who is there for what reasons, and you find your people really quickly, I think.
Yeah, I bet it's pretty liberating in a sense, but also pretty, yeah, like you said, makes everybody pretty honest in a way.
Yeah. When this last COVID surge, with our third COVID surge, and we had a whole huge batch of travel nurses, they'd been there like a week, and I already had ones that were my favorites, and we're still friends now, and they've been gone for a couple months. Like, you make friends really quickly.
Just to clarify, what is a travel nurse?
Oh, it's a nurse that takes a contract with a third-party agency during a time of crisis when hospitals are really short-staffed, and the agencies are paid by the hospital. They take a small cut themselves, and then they pay the travel nurse a lot of money, generally, especially in COVID times, to come and work a short contract, usually somewhere between 6 and 13 weeks at a hospital that is not their home hospital. And during like the worst COVID surges, the last 18 months, some travel nurses were making like 10, 15K a week at certain hospitals. Jesus. I have a lot of friends that have paid off their houses and got a huge steaming side dish of trauma and PTSD to go with it. So
and you have all that, and
I didn't even get a travel contract.
Right from home.
It's right here in my own backyard.
Home is where the trauma is.
Yeah, from the unsafety of your own backyard.
There's locums tenens jobs for healthcare providers, which is...
Excuse me? Did you just have a stroke?
No, I said locums tenens.
Is it Latin?
It is.
Are you summoning a demon?
Maybe.
Maybe, yeah.
You know, I
Depends
think,
on the tenums.
which Tennums we talking about here?
It sounds like I think that I think the demon has already been out. I think you're trying to put it back.
Listen. Locums tenens is just a comment. Guys are jerks.
Sounds like a 1940s comic strip.
Locums tenens.
Locums tenens. Right there next to Family Circle and Heathcliff.
Nombre ducatos.
Yeah.
Temporary positions for like
Dejun.
mid-level providers and physicians.
Or like a white zombie.
There's a lot
sort
of
of.
there's a lot
track,
of
you know.
Latin in medicine. I don't know what to tell you.
And in satanic rituals.
Yep.
What do you think we're doing in the hospital?
Oh, well, at least she said it. Now, truth is out. You heard it right here. You heard it right here. Nurse practitioner confesses to doing satanic rituals while refusing to administer ivermectin and insisting on vaccines.
Well, what was the new thing? You're gargling
Iodine.
iodine.
Yeah.
Oh,
Yeah.
I don't
That's allowed. We can do that.
definitely not satanic.
care. Just don't come and see me after you do it.
Right.
Gargle whatever you want to gargle.
Yeah, do whatever you want. Yeah, of course. Just
Yeah.
don't do it at my hospital. Don't
I did have
don't fuck with my finite resources.
I did have a patient who had COVID and was unvaccinated, and they overdosed on ivermectin prior to arriving to the hospital. And because of that overdose of ivermectin, the patient had seizures and was much more unwell than some of the other patients. Almost like the ivermectin didn't
Interesting.
help. I don't know.
Thought-provoking, really.
I mean, it is anecdotal at best.
Yeah. One person who you can extrapolate that out.
Liver
to.
failure and renal failure, which, to be fair, are also common with severe COVID. The patient did die
Did also have severe COVID.
and died.
So-
They are dead.
This podcast is brought to you by HIPAA.
I said they the whole time.
True. No violations.
Just wanted to have a gentle reminder because I don't want to have to do a lot of work editing things.
Fair enough.
It's pretty wild that HIPAA threw their hat in with, For Hymns and HelloFresh and all this other bullshit.
Excuse me?
Wait, what?
Oh, it's our sponsor. Yeah. Brought to you by HIPAA. Yeah. Until we can get that real
What's
sponsor
for
money.
hymns?
It's like male enhancement sort of shit.
Oh,
but
like the gas
natural or
station?
something?
Natural.
Like get some motherfucking Blue Chew.
Yeah.
By natural, do you mean blood? Because that's
don't know.
usually the cause of an erection.
I don't.
It's just blood.
It's just a vial full of.
I really got
Full
you.
of- It's just a vial full of penile sponge. Is all it really is.
Yeah, that really got me.
I really did.
I was just imagining like someone just like, here's some fucking blood from somewhere. Shoot it into your dick, asshole. What are you, a coward? This is how dicks work. What, do you need a pill to get hard? What's wrong with you, you child? Just take this blood and shoot it into your dick.
Just don't read those instructions backward. Don't shoot it into your asshole, dick.
Or don't take the blood that's already in your dick out of your dick. We're trying to put more blood in your
We
dick.
have to do that sometimes.
Because they're too hard?
Well, when I say we, that's a loose term. It is a common emergency. Common. I don't know if it's common.
Anecdotally.
It's definitely an emergency. Priapism. That's what it's called. When you have an erection lasting, I think, longer than 4 hours.
That's what the commercials tell me.
Okay. You stick a big needle in it and drain the blood out. That's the solution. The only way out is through.
But I thought those worked by thinning your blood. Is that not
No,
the
it's a
case?
vasodilator. So it enlarges the blood. It enlarges the blood vessels, giving them more chance to be engorged.
That's the word.
Do you like all my I'm really glad we chose not to video everything today.
Let's start over. Let's turn the cameras on. Turn the cameras on.
That is the word. That is the word. Engorged. Fucking so there's been instances like so what happens if you Google here, someone take one for the team here and Google
I've probably already Googled it.
my my dick won't stop being hard. Like,
Oh,
what do
that's-
I do?
yeah.
Because
I'm not Googling that.
because someone try, like, I'm just imagining being this person that when WebMD fails them because they're now at hour 2.5, and it, maybe WebMD says, all right, if your erection lasts longer than 4 hours, you need to go to the fucking hospital.
I don't think they're sitting there like passively with an erection. I think that it's painful. And so I think that the pain drives them
Like
to the. I do. I mean, do you want me? I'll
The rest
Google-
of you
I'm
just
gonna
shrivels
Google
as you're.
like it just
all there.
So the answer is, yeah, like when you don't go to WebMD yet, you go to, well, I guess it's shut down now, but you go to Yahoo Answers or Quora.
Ask
oh,
Jeeves.
Cora.
Or maybe ask Jeeves if that's still around. Jeeves knows. He's probably taken.
Jeeves is.
Yeah, he's a lonely
He can
butler.
He can speak from experience.
Yeah.
Now, are these things that happen whenever people take too many dick pills? Is there an instance of this happening without the presence of dick pills?
Probably. I don't know why though.
I'm trying to ask the professional. You're busy. You're Googling. You're doing research.
I am, and
You're doing your own research
I'm
right
upset
now.
about it. I wish I hadn't.
Well, it's all
Ugh.
all for science. But yeah, like I don't know. I
Priapism.
Here
It's a prolonged erection of the penis, usually without sexual
what
arousal.
else would it be an erection
It's
of?
Unwanted and persistent. Oh, you can have an erection of like
The pinky, the ear, the nose.
of a hair follicle. Erection just means straight up.
Straight up, bro.
You can have erect nipples.
Yeah, that's true.
You can have erect hair. What do you think goosebumps are? You can have erect follicles of anything.
I've never like felt goosebumps.
You erect a building.
I've never like looked at having goosebumps and been like, you know what? This is a lot like being horny.
I am so.
Listen, this
erect
is
right now.
just a word.
Just a fucking 100 tiny dicks here on my forearm.
You can have an erect posture.
Yeah, I understand.
I mean,
that.
no, people don't use that word a lot, but you erect a structure. You like whatever.
No. People use
Yeah,
that
yeah.
word where it should be used. So I mean, let's not get into too many details here, but I used to work adjacent to an insurance agency, and we got a lot of company names on lists, and the number of companies who are named something like huge steel erectors and shit like that, astronomically high. People know what the fuck they're doing when they name their companies.
What's important about this
But
is
this isn't a. But this what we're talking about is not what this is. Everything we're saying is true, but this is in a subset of this condition. Priapism. Was that what it's called?
priapism.
Priapism.
So
Piss
listen,
in your mouth.
It's just the important things about it are that it's typically unwanted and persistent. Like you didn't. It's not due to sexual arousal. Most commonly, it may occur spontaneously, which sounds real unfortunate.
It sounds.
Sounds like junior high.
Or from but that's still sexual arousal. You just don't want it.
In a sense. It's
But
like-
or from certain antidepressants or erectile dysfunction drugs, just like we were talking.
Yeah.
My favorite part of this is the like bullet points. It is treatable. Great news. Usually self-diagnosable.
Doc, you gotta tell me.
really
I don't know.
Is this hard?
There you go. Lab tests not required. It says short term, and it is an emergency. It's a medical emergency because if you don't fix it, your penis might fall off.
Yeah.
Just clean off.
Well, I mean,
You
not like
you hearted yourself. You hearted your dick off.
not like an icicle or something, but like you can cause ischemia to the tissues.
What's ischemia?
Lack of oxygen.
Okay.
Oh.
Not eczema.
Eczema is a rash.
Skin rash disease.
Yeah, not related.
Not related.
Um,
Why are we talking about erections lasting longer than 4 hours?
Because I brought up dick pills.
It's
Well,
your
I brought
fault.
up male enhancement. I don't know if that's the same thing as erectile dysfunction.
Oh yeah, because we're talking about sponsors. Because I'm
Sponsors.
talking about sponsors and HIPAA.
Right.
Yeah. So
right.
and you were talking about ivermectin and it not doing much of all of anything for this particular patient. Is what you were talking about.
No, that patient is quite dead.
Yeah.
Well, so anyway, here we are.
We're sponsored by the Grim Reaper herself here to announce that all of my patients are dying.
So in this ray of sunshine is my wife.
That's me.
So this is sort of a little follow-up to, we did an episode a few weeks ago, just sort of talking about what it's like to be a nurse practitioner. So if you want more of that, or you should probably listen to that first before you listen to this, because we're just going to kind of pick up where we left off and whatnot. And so, Allison, hello.
Yes. Hi.
And Robert.
I'm Robert. I am a completely inexperienced medical non-professional. Do not take any of my advice seriously.
And yet, given that lack of experience, you still find it plausible to, and I dare say even easy or expected to believe what medical professionals say.
Yeah, well, I'm the very definition of a sheeple. I do what I'm told.
I see.
At any cost to my own personal enjoyment or benefit.
And does that make you, I feel like that's what makes you such a good computer programmer and good artist, good, good guitarist. Is what makes you so creative is you just do what you're told, right?
Yeah. Pretty much.
Yeah, pretty much.
Pretty much.
Like if somebody who knows a whole lot about something tells you their opinion about what you should do to how to fix the thing that you don't know a lot about, but they know a lot about, you're like, yeah, okay.
Well, if they know a lot about it, then I begin to suspect them. Because then you can never know who's,
I mean, I was going to call you a pushover if you just believe people that know a lot about stuff.
Who told them all those facts? Facts? Come on.
Yeah, I mean, at a certain instance, the only way that you're able to know things is through institutionalized knowledge, and knowledge is dead imagination. It's not alive. It's impure. And so
what is
all
alive
of these
imagination?
See, that's the kind of things that lead you down the so you think like that and you're going to be a sheep.
Listen, I just thought of something that doesn't have anything to do with
this is all
any
bullshit,
of this.
just to be clear.
Yes. Yeah, no, listen to medical professionals. Listen to
and
the
that
experts know what they're doing generally.
I mean, to circle back around, don't listen to anything I just said, and much less any of us other than Allison.
Also, a disclaimer, this podcast is not meant to be medical advice. If you have a medical question, please contact your primary care provider and or seek emergency care, especially if you have an erection lasting longer than 4 hours.
Yes. Go to WebMD at least.
WebMD
away
is
from Yahoo
fine,
Answers.
but...
if you're not going to go to the doctor, at least go to WebMD.
Sure.
I mean, better
go to the doctor.
Better WebMD than YouTube,
But
and
yeah, that's true. That's true. Better than like Siri.
Well,
I don't know if she can help.
I don't know Siri. I've never talked to Siri on my phone. It makes me uncomfortable.
Yeah, I don't like that either.
Alexa neither. I'm not discriminating.
We are not an Alexa household. I don't want all that. But what I wanted to bring up this is a very random left field thing, but I just think it would be interesting for the three of us to talk about it. It doesn't really have anything to do with COVID, which is kind of why I'm sitting here, but it does have to do with medicine and medical treatments. I saw a billboard on my way home yesterday, and it said, "A trip worth taking." And it's an advertisement for psychedelic therapy. And I felt like I felt like I had just jumped like 20 years into the future. Like I felt like this was like a scene from like Blade Runner or something. And I was like, "Ooh, what is that?"
Yeah, like,
I was amazed.
What was was it like microdosing or?
I wasn't sure. I didn't. It was at the junction of 610 and West Park Tollway, right when you like are kind of getting on. And I was talking to you and yelling about all the dead COVID patients, and I looked up and I was like, what is that? Because the word trip was in like a rainbow pattern, and so I thought it was like an LGBTQ kind of billboard, but then I saw the psychedelic therapy thing on it. So next time I drive by, I'm going to look closer. But I was astonished. I was like, how is that here and we still don't have medical marijuana in Houston? Like, what is going on?
So before we riff on that, I want to preface it by saying go and listen to the Conspirituality podcast. And there's some specific episodes.
Maybe they'll be a sponsor. That would be
I don't think that podcasts sponsor other podcasts like that. They have a pop-in Patreon. They don't need anybody's help. But those guys, because one of them had actually written a book about psychedelic therapy and whatnot a few years ago. Anyway, those guys toe a really, really... They're doing some really great work, and they toe a really great line of where they're all yoga instructors and come out of that health and wellness community, but they're pro science and
evidence-based health and wellness.
Yeah, and so they so anyway, there's a few episodes or an older episode where they sort of riff on this idea. So if you want like actual information and not just speculation, go listen to those guys.
I don't know anything about any of that. Not I don't know good information about it.
Right, because what they talk about a lot, some of the things that they talk about is that you're going to have problems because yes, psychedelics can do good things, or at least they're not inherently harmful, right? Like that's really it. It's not necessarily that they're guaranteed to give you good things. It's just that they're not inherently harmful. But what those guys talk about is that some psychedelics are not meant, they don't fit into a capitalist model because you're not meant to keep taking them. Like you do them once and then you're like, all right, cool, I'm good for a while. And so that's why. And
it's hard to build a business off of that.
Right. So they sort of almost issued, the tone was almost like a warning, like get ready because this shit's coming, you know? And so I don't know, man, that whole trip is
I mean, this says you can do 6 sessions of ketamine for about $6,000.
Is that what did you?
It's a Texas Monthly Reporter thing from a couple months ago, saying the rise of psychedelic therapy in Texas.
Listen, I think that's really interesting that it's ketamine because we're using that for
and MDMA
seizure
as well.
and pain control in our ICU, and I happen to really love the drug ketamine, not as a user but as a provider. I've never experienced it myself, but it is an amazing anesthetic.
Yeah, because what do you call it? A dissociative?
It's a dissociative drug.
Yeah.
It's really good for pain control. It's really good for seizures. That's what we have it approved for at my institution. It's cheap. It's available. And what I like about it best as a critical care provider is that it doesn't typically drop a blood pressure. So like if you are taking propofol or a narcotic or something, it tends to lower your blood pressure because they act as vasodilators. And I'm not familiar enough with ketamine to know its like pharmacokinetics as well as I know other ones. But I know that when I give it, it's not dropping my patient's blood pressure. And I think it's one of the reasons that it's used a lot in kids as well. Paramedics like it a lot. EMS providers like it. I don't know. I think it's the fucking future, and I wish that we could use it more.
When you say they like it a lot, it carries a different connotation than what you mean.
I know it does.
I understand. What you're saying.
when a healthcare provider says they like a drug, it's not because we're using it. It's because we like that it helps our patients in a safe way.
Not to be a bummer, but that young boy that was killed had like the heart attack or something like that.
Yeah.
Wasn't he giving ketamine?
He was a drug at a dose much higher than his body weight allotted for. I mean, there still is weight limits to things. There still is an anesthetic limit to something. And to be extremely clear, when I talk about giving high doses of ketamine, I am doing it for patients that are on a ventilator. And I am supporting their blood pressure with other drugs. I am breathing for them. I am monitoring them closely.
Right.
When ketamine is administered in an emergency situation, it's usually used for an intubation, which is when you put somebody on a ventilator and put a breathing tube down their throat. It's
Gotcha.
used as a drug. It's used for general anesthesia.
I understand what you're
It
saying.
is not frequently used as just a sedative or something like that.
Like you said, emergency situation, like dire circumstances.
Exactly.
Right.
And in the case of that boy in Colorado, from what I read, they used it like 10 times over his weight.
Jesus Christ.
And I don't, without even opening the door to all of that, there wasn't even like a reason for it, which made it
Wow,
even
just
more
someone just going
powerfully upsetting.
Cowboy on the ketamine there.
I mean, like, you can't just sedate people because they're angry. Like, that's a chemical, we
Sure.
call it a chemical restraint in the hospital. That's what we call it. And I only chemically restrain a patient as a healthcare provider when they are in danger of harming themselves or others. And I'm fairly certain that the people who administered that drug to the kid who we're talking about were not in danger from
Yeah,
him.
sure.
And as far as I can recall, I think that there was actually some charges filed recently.
Good.
against those.
I'm blanking on his name.
I didn't hear about that.
I'm pretty sure you did.
You did.
No,
He
I missed
was.
Well,
I feel bad for not being able to remember his name right now too.
it happened in Colorado. I
It
believe,
did.
Right?
Yeah, it was an African American kid.
Colorado kid.
It's like not Brian or something. No, Kevin.
Elijah
Carl?
McLean.
That's it. Brian. What the fuck am I thinking?
What are you thinking?
Stupid names.
But you brought up
Sorry,
some,
Brian's.
Yeah.
you brought up some things in there that I want to ask you about and pick apart in a second.
Okay.
But before we do that, I wanted to put a pin in this sort of the psychedelics thing. So I have pretty limited experience with psychedelics, but I have a lot of experience with people who have done psychedelics, and my personal experience with it is that I don't, because people like to talk about it giving you, like you learn things on psychedelics and whatnot, is how a lot of people sort of sell it. Now, I'm not talking about sort of legit, whatever that means, therapeutic scenarios and whatnot.
Controlled settings.
Yeah.
Monitored. So to
yeah, I'm
speak.
talking about people doing their own mushroom ceremony or whatever.
Yeah.
And
Sounds like a bad recipe.
and so I accidentally smoked some pot one time that supposedly had acid. I don't even know if that's a real thing in it, or if that's a real thing.
Laced.
I think
Yeah.
it can be. I think it
Okay.
can be like
Totally.
laced with
Okay,
LSD
cool.
and stuff.
So and I had like the experience I had was it was sort of a sense of emotional clarity. It wasn't necessarily pleasant, but it allowed me to see a situation very, very clearly, which gave me conviction to make the right decisions later whenever I sobered up and for the coming weeks. It was with a breakup and whatnot. But the thing is that I already knew that going in. And that's sort of my hot take on psychedelics is, do psychedelics really teach you anything that you don't already know or
I mean,
feel
it's not
or
like you're going to
believe?
come out of a psychedelic trip knowing like calculus that you've never taken.
Right.
Yeah, the idea that it quote unquote teaches you something.
It sounds more like it
It's
just
a bit much.
reveals or
Yeah.
opens your
It kind of maybe
mind to an idea that's maybe you've been suppressing.
Yeah,
Yeah.
it might like maybe it quiets the bullshit. Like maybe
Exactly.
kind of,
Sure.
like
or
the
whatnot.
fog sort of goes away, it like drops the veil a little bit.
Right.
Like when-
You could also just exercise really hard. Maybe.
Well, and a lot of times when people get like really drunk, they become like they start saying stuff that they're actually thinking. They become like very honest. Maybe, and I can't say because I've never tried like a psychedelic, but maybe it kind of like does that internally for you. Like
Yeah.
you just are more open to your own ideas of what
Right. And
you actually feel.
And I mean, the people that I know who've done them a lot, they haven't really changed much in the time that I've known them.
And why would you do that like a lot? Like
Well,
why
they
is
don't,
that?
they don't do it a lot.
But like, yeah. I mean,
I get like it I guess at best, at best, it can give you some clarity about some hard decisions that you need to make. And at worst, it probably just does what anything else will do, which is prop up your own bullshit.
I do recall reading some evidence that there is positive effects for like PTSD and things like that, because maybe it kind of helps you. I don't know. I feel like a fucking quack.
Yeah, I was like,
Right,
this
yeah.
isn't a conversation I feel like I should be having because I just don't have any experience.
But
Yeah,
I guess the long and short of it is that I am not against that kind of therapy. I think that it's interesting,
Yeah.
and if it's done in a safe and monitored way where the person taking the medication feels safe, there's no reason that we shouldn't, because a lot of the
Right.
drugs I give in a hospital, like ketamine or like any of these other stuff, can have a very profound effect on you.
Totally.
I've been given drugs in a hospital setting that made me feel absolutely horrible. I'll never forget when I was in the hospital with some acute pain due to a dying fibroid while I was pregnant with my son. And they gave me a drug called Stadol. Let me tell you about Stadol. That shit fucks you up. I will never take Stadol again.
What is it?
It's a narcotic, and it's an old drug, and it's safe when you're pregnant. So they like to use it because it doesn't cross the placental barrier. As soon as they gave it to me, I felt as though I had drank about 2 bottles of wine instantly.
Whoa.
I felt very drunk, and I still had the pain. So it was not.
Yeah, I mean, at
It's
that rate,
not good.
it's kind of like a crapshoot for every individual person, right?
Sure,
Like,
because some patients
could be
respond
anything.
really well to certain things, and sometimes they don't.
and not just like allergies, but like just
No, absolutely. Yeah. And I mean, drug allergies in reality are pretty rare.
Right.
Most of the time that people talk about being allergic, quote unquote, to a drug, it's usually that they just don't tolerate it well. Like it gives them a lot of nausea, or it gives them a very bad headache, which are generally just side effects.
allergic in a very like general sense
Yeah.
to them.
And I can talk to you all day about morphine, fentanyl, Dilaudid, propofol, Versed, ketamine. I can talk to you about those things, but I cannot talk to you about like MDMA or
Right,
like
yeah.
other things like that. And there are some people that do know a lot about that.
Right, and I guess like I don't want it to sound like I'm shitting. I absolutely don't have a fucking problem with anybody doing any of these things.
Yeah.
No, I don't
whatsoever.
either. I don't either. I just don't know anything about it, and
right.
I don't feel like I can talk smartly about
That's where
it.
I'm coming from too.
Yeah, I've had the very limited experience of people talking about these things as replacements for therapy, as replacements for other medicines and replacements for other things, and sort of like this is talking about these things like they're nature's medicine, and real in a very like heightened sense of that. Like, no, I don't need to. I don't need to reflect on my past, or I don't need to go talk to a therapist. I just need to do a mushroom ceremony, and that's going to set me right. And that I think is kind of bullshit.
That sounds like you're scared to confront yourself.
Yeah.
It sounds like you're scared to hear what a therapist might have to say to you.
Yeah.
Yeah. And then the language that's
Because I
often
don't always like what my therapist says, but
that's what they're there for.
yeah, but that's why I pay her money.
Yeah, and the language that surrounds those things a lot is often sort of in a very, it's all in this like language of growth and all these types of things. But all the people that I have known, like the people I know that have grown the most are not those people. In the past few years, the people that I know who have grown the most are people who just by happenstance stay very far away from those things. So it's not.
I'd like to think of something like that with my very limited knowledge. I'd like to think of it as a really great adjunct to other treatments that you're doing for something like trauma or PTSD
Right.
or severe depression
Sure.
or
Right.
severe anxiety. I think that there
Yeah.
things that are, depression, anxiety, PTSD, those kind of illnesses are so like, if you have high blood pressure, I've got kind of like 6 or 8 choices about how to treat it.
Right, because it's like a
depending-
mechanical problem.
Right. Like depending on like your age, your race, and your other comorbidities. But if you're suffering from like severe PTSD, I'll take everything in the garage to like try and figure out how to help you.
Right.
And so, but I don't think that there's any any mental illness in the world where you can say you need nothing else except X. And I don't think there's anything where it's like you only need this one thing, because do you need sunshine when you have depression? Yes. Do you need to stay hydrated? Yes. Do you need to avoid your triggers, whatever those are that are I'm going off on a very
just like everything else, it's a balance.
There's no simple solution to anything, which is why the Conspirituality podcast is so useful, because conspiracies are generally simple solutions.
Right.
Yeah.
And but yeah, with like whenever I was having my bipolar issues and whenever I was on medication, I never made tangible progress until the medication was combined with counseling. You know, consistent weekly one-on-one counseling. I needed both. One by itself wasn't enough.
Right.
And so I needed the medication to sort of dial everything down, to turn the volume down, so that I didn't feel like dying all the time or being impulsive, so that I could get out of bed, you know. But I also needed someone to sort of sit with me and help me see my own patterns and see my own. And the thing too is, you need to, if you're going to have a therapist, if you're going to go see a therapist, you really need to commit, I think, this is my experience, to seeing them for several weeks.
I thought you were going to say years.
I don't know about that, but
weeks for sure.
Because I didn't start talking about the real shit. In my experience, I didn't start talking about the real shit till like third or fourth week.
Sure. I was going to say week 3 or 4. Yeah.
You know, the first 3 weeks, I was just saying the same bullshit I say to everybody. Like, it was just like, it was just like, oh yeah, hit that number on the jukebox, you know? So it takes a while to kind of peel back those layers, I think. So,
right.
But yeah, couple that shit.
Yeah. But when my mom died, oh
my God, your mother died?
Yeah, she's gone.
Sorry, I'm being a sarcastic ass.
I am too.
Your mother died like
gallows humor is
like 5
top
years.
notch. Yeah.
Your mother just died like 5
Mom
and a half
is
years
very
ago.
dead. Thank goodness she didn't have to deal with this COVID bullshit, and she didn't have to see Trump's presidency. But I digress. When my mom died, a few weeks after I came out of the fog, my husband here next to me suggested that maybe I should talk to somebody, and I found my therapist, Nancy, who was I don't know. I mean, she really clarified a lot of things for me. She let me talk about a lot of stuff with my mom. And then she told me that she thought I was doing great. So I went and I got married, and I got my arm broken, and I got knocked up, and I had my son, and I moved on, and things are going good. And then all of you motherfuckers got COVID, and now I've needed a lot more help. So I went back to her, and man, it was really good that I got to talk to her. And the other thing I did was I went and I talked to my doctor about my anxiety and about how I was like scared to go to work, and I was like not sleeping, and I wasn't doing well. And so that's when I got on Zoloft. Was probably about month 5 of the pandemic. So between medication and therapy, I'm proceeding forward versus quitting my job, hiding in a hole, pulling the dirt in after me.
Yeah, that is a really frustrating thing, and it's something it's something I've said. I know I've said it in private, but I don't know if I've said it to you. Is that, you know, a thing that's really frustrating for me in a lot of the rhetoric that goes around is that, like, this idea that if you aren't a COVID skeptic, that you are afraid. Like that idea, like that. And so like that all that we're doing, you know, is like based out of fear and all that sort of stuff. That's a criticism you get. Like if you get the vaccine, you're living in fear.
If you wear a mask,
you're living in fear. I'm not afraid. All those types of things. Yeah. So it's like either you're living in fear, or also like you're just doing what you're told, right? That kind of thing, right? For one, I think that's just a gross sort of reduction and oversimplification of what fear even is. But the point that I'm getting to is that I'm really grateful that, because you want there to be examples of heroism for your children, right? And Max, our son, doesn't have to look very far. He just has to look at his mom, and it's like, that's what it is. Because what a hero does is a hero looks at their fear, acknowledges it, faces it, and then does what they need to do anyway. Does what they need to do to help other people.
Mm-hmm. Yeah.
Sometimes people who don't, and it's not up to you to decide whether they deserve that help or not. That's not your job. Your job is to help them. So you help them.
Right.
And I think it's incredibly heroic. I think it's an incredible example. And I think it's just, I don't know. I think I'm really grateful
For sure.
for that.
Thank you.
So, but what you talked about, like dealing with your fear, it reminded me.
Mm-hmm.
It reminded me of that, because that's what you really do. Like, I was afraid when you got the vaccine last December, because it was new. That wasn't a rational fear,
I was nervous too.
but I was afraid. And so I was afraid when I got it, because I got the Johnson & Johnson, which is a little different. Well, you got the Moderna, right?
Pfizer.
You got the Pfizer. And so, but these weren't rational fears, And so, like, this idea that like, if you haven't experienced fear in this pandemic, I don't think you're paying attention. I don't know how someone could just.
That's the thing, is that, like, when I'm accused of living in fear, it's because the first several months of the pandemic, before we were really clear on how COVID behaved, and do you guys remember when we were like all wiping our groceries?
Oh yeah.
Like we didn't really know. Like, now we have pretty solid evidence about surface contamination is very low. Transfer on surfaces is very low. But the first few weeks, I was getting undressed outside my house.
It was scary.
So that I could, like, wash my clothes away from, like.
You know what my favorite memory is of that time? One of my favorite things that feels very nostalgic is that walking around the neighborhood.
Oh, yeah.
Right? There used to be a different wave. Okay? So, like, you would wait because you were happy to see people, but before you really knew how contagious this shit was, but you needed to be outside, man, because you need that sun on your face. So when you waved at people, it's very.
Because it was kind of a high, but also you stay over there.
Yeah. There was just like about 15 degrees of difference between high and stay away.
Before we really knew that, like, the 6 to 10 feet was like that magic number, you were like, I don't know how close we can get.
Right.
And we don't even know what's going on. But we're going to stay over here.
It was always that. It was always ready to, like, stiff arm, like, for the touchdown. Whereas, eventually it just, hey.
I remember walking around and seeing, like, this, like, very elderly woman, like, scooping some leaves in her yard or something. I was like, I can't believe she's outside. Like, I was so worried. I was like, go back inside, ma'am. Like, I didn't know what was going on.
Yeah.
What are you doing, you maniac?
Yeah.
He's diving in the street.
Why are you in your yard? This isn't safe.
Whenever it was back in, like, March
like,
or
literally,
April,
like, the first, like, 8 weeks before we really had a handle on things.
When it was like, oh, there's like 20 cases.
Right.
And
back when they were counting the cases on a daily basis.
Back when I could keep track of how many people died.
Right.
I remember I've never been in a situation where I felt as though I felt scared to go in the rooms, and I felt afraid, but I don't know. I
mean, it's not a bad thing to be scared, though.
Right. That's the thing.
It's
Is that
all
like
about
why
context.
why is fear?
It's all about context.
Why
it's
is
a
fear
survival.
so negative?
It's a survival
sometimes?
mechanism,
Right?
It's because you understand the thing that you should be scared of.
I
You understand
also-
why you should be scared of
I
it.
also knew that I really wanted to try to help them.
Yeah.
And every once in a while, a patient would come by who looked exactly like me. She was in her 30s. She was a mom, super sick, and I'd lose my shit. And I'd go and sob in a corner and sit down for a second. And then you wipe your face off and you go back to work. Like, one of the things that pisses me off.
I mean, that right there is just what Richard was just talking about. Like,
what
you are scared of it. You acknowledge that you're scared of it, but
yeah,
you're like,
because
gotta
I
fucking do this.
appreciate that COVID doesn't give a shit who you voted for. It doesn't care how old you are.
Yeah.
There is no guarantee about how sick you will or will not get.
Right.
Some people don't get sick at all, and that's true. And
Yeah.
some people get so sick that they never recover.
Yep.
Yeah.
And one of the things that made me the most angry was people saying, well, if you're a doctor, a nurse, or a nurse practitioner, if you're a healthcare provider, you signed up for this. Listen, the last time that there was a pandemic of this magnitude was 1918. And I'm willing to bet that there's not a lot of people around right now that were around during the 1918 Spanish flu.
I mean, just ask anybody if I increased your daily workload 20x, are you going to say that you signed up for that?
And
No,
not
you're
even
fucking not.
not even increasing it because
No matter what it is.
and not even increasing it because like I can handle a busy unit. But
Yeah.
increasing it with a thing you've never done before.
Increasing
that
the
you
magnitude
that
of
you
it.
have no
Yeah.
treatment
or, like,
plan for.
the intensity of
I
it.
have
Exactly,
and,
yeah.
and like I have oh my god, this microphone.
Attacked you.
Yeah. So she was in a rolling chair, and her
Jesus.
microphone is on a tripod stand, and one of her wheels hit the leg of the tripod stand,
it
and for
brought
a
it-
brief moment, the chair and her and the microphone were just all moving as one unit. It was chasing her.
More reasons that we don't have the video camera on right now. Damn. I know.
It's missing so much.
Engorgement.
Like we missed the engorge joke. We missed this microphone attack.
The thing that was the most
Attack of the killer
This
killer
is-
SM7Bs.
I'm trying to be serious. The
Sorry.
thing that was the scariest, because if I have the busiest ICU I've ever had and it's full of just various patients having cardiac arrest because of hyperkalemia or because of lactic acidosis or because they just died and I haven't really figured it out yet, or because they had a stroke, or because they have really bad sepsis. Like, I know what to do about each of those things. This was the busiest ICU I've ever had, and I had absolutely no plan.
Right.
No plan, no map, no treatments, no nothing. All we could do was go room to room and watch them die.
Right.
And we are barely past that. And I think that's why 55 minutes later, I will say that I came back in this room to re-record some podcasting, is because I wanted to talk about what COVID does to you, because I think that a lot of people still think that COVID is a cold or
Bad flu.
a bad flu or
Right.
or whatever.
Yeah, that
And-
was one of the things that I wanted to ask you.
Yeah, but
And-
before you do that, I need to take a small break.
All right. Well,
I
while
need
you
to-
do that,
I need to
I'm
go
going to
look.
talk about another instance of fear. So
yeah,
go
okay.
take your break. And you good?
Go.
Okay.
I don't have to go take a break.
All right.
I just took a break. What does that mean? You'll never know.
I'll never know. Robert's like, I wear diapers. Or like
Pull-ups, please.
pull-ups, please. Or
I'm a big kid now.
Or I've been slowly depositing piss into the pipes of this desk. One day.
Getting heavier.
Yeah, every day. I have the keys.
To the future.
Yeah. More comedic gold missed.
Too bad. Anyway.
But yeah, so on that whole fear thing. So my dad died on a road very close to my house, very close to where I grew up. And so I have to drive every time. So growing up, when I started driving, every time I left my house, I had to drive by that spot.
Right.
And so, that's very loaded. And so, and then there's layers to it, because then at one point I had an accident,
Right. I remember that.
on that, and that very close to the same spot, really, really scary and really freaky and all those types of things. But where the fear of it really hit the highest levels, the highest intensity, was whenever I would take my son out there to visit my mom. And so I'm driving on this road with my son. And so there's a lot of anxiety, there's a lot of fear there, obviously, because I am not afforded the luxury of assuming that accidents won't happen. I know that they can. I know people die in car accidents. And so...
Yeah, I mean, you're acutely aware of it because of that.
Right. And so, but all you can do... But what am I going to do? Never visit my mom?
Right.
Or I mean, she's no longer with us, but before that, of course. But yeah, or what was I never... wasn't never going to... Never leave my house, always have some.
Right.
That's not reasonable. It's not rational.
Right.
All you can do is name it, acknowledge it, and then take as many precautions as you can, as long as those precautions don't become diminishing returns on the, like, okay, well, I'm only going to go 30 miles an hour or something,
right?
Because then that becomes dangerous for a different reason.
Exactly. Yeah. I mean, you mitigate what it is in your control to mitigate.
There you go.
Right. And past that, you can't control what external forces are going to do.
Right. So, in that context I'm referring to, I'm going to be extra sure I don't check my phone. I'm going to, I don't think I'm going to be rocking out to the radio on this curvy country road.
Sure, yeah.
And so, because those are things, and I'm going to be extra vigilant watching what the other cars around me are doing.
Right.
But that's really all I can do.
Right.
That's really all I can do. And so, but yeah, I like the way you said that. You mitigate what you can mitigate, and then you do what you can.
Yeah.
So,
and that's just kind of how it, you are, the fear is there because there is a reason to have been scared. Like, you have been demonstrated that this shit can be dangerous.
Right. I think that's why getting old is such a bitch.
Now we're getting down to it.
I mean, you hear what I'm saying, right? You see where I'm going with that?
Is because you've learned so much that can be scary.
Well, you've seen so many. You have all these data points.
Yeah,
and
exactly.
Well, that one time that went bad for that one person.
Right. Exactly.
And all these things, coalesce to make you terribly boring and risk averse.
Yeah. Well, I don't know. It depends. Yeah. On some level, sure. I guess for me though, I look at that and I was like, it just makes sense to react a certain way or to take a certain measure of caution.
Mm-hmm.
If that makes me boring, my whole life I've just been like, who fucking cares? Whatever. I'm a little boring. I'm fucking alive and I'm healthy. Fuck you.
That has been a pretty consistent. I feel like that's something I can confidently say about you the entire time that I've known you.
You're fucking boring.
Not what I meant. What I was going to say was that you...
I said it. It's fine.
You've one of the few people that legitimately just don't give a fuck. That's how it's felt. Like the whole 20 some odd years of 25 years or whatever of knowing each other.
Mm-hmm.
Is that Yeah, like Robert, it's just always understood that whatever happens, Robert's gonna be like, oh, okay. And Robert's gonna do what Robert's gonna do, and Robert's not really gonna care what you think about it. Because Robert's gonna take care of Robert,
Yeah.
Robert was the groomsman I worried about the least in our wedding.
That makes me feel good.
I mean, were you worried about
Jet.
I wasn't worried about Patrick or Jacob.
I was gonna say.
I really wasn't, but like, there's at least some wild card to that.
I guess there were more things that could have come up with Jet.
Not really.
No?
I mean, I don't know. No.
Jet, call into the show and tell us tell us how wrong we are.
I'm gonna fight with the mic again.
What Jet did do though, and I was really funny. You probably remember this, but like before we like walked out of like the groom's cottage because we got married at a fancy place.
Yes.
He dangled his keys at me. He was like, "All right,
I can't believe he did that.
last chance."
Was he serious though?
I mean, yes.
Yeah. That's just how good of a friend he is, because he's like, all right, I ride or die, whatever decision you make, I've got you. Is really.
I guess really what I should have said was that I was basically only worried about one of the groomsmen.
Okay, that makes me feel not as good, but
But
also.
but I
understandable.
absolutely wasn't worried about you, and I am.
You were definitely not that.
I'm 90% sure you were the first one to go get your tux because I got all the emails when like people would go get their tuxedos. Yeah, I'm like almost certain you were the first one.
All right, I don't
Did
remember.
we have 5 or 6 people?
6.
Yeah.
Robinson. No.
Yeah.
Yeah, he was there.
Robinson was it? Okay. I was like, who was the other one? There could have been something weird.
He rode with Jet.
That's it. Yeah. There you go.
Yeah. Yeah. Wait. So Jet, Jacob. Yeah, you Robinson.
And Harrison brought you, and Harrison wasn't
Right.
in the wedding, but Harrison brought you.
Right. I get confused because Rothwell was the officiant.
Right.
And so I kind of had a cheater. I had a 7th.
So he was there for sure.
So
I had Farron.
Oh yeah, she didn't want to be. Right.
She came and she read a poem. She
Well,
was
but she
was at
didn't-
my house party.
She didn't want to be.
No, she didn't want to be a
bridesmaid.
bridesmaid.
I see.
No.
Well, before you left,
Bad luck.
I mean, sometimes you just fucking get sick of it.
Oh.
I was a
Okay.
bridesmaid like 7
Yeah,
times
never mind.
before I got married.
yeah, how many times have you been a fucking groomsman? Like twice?
Once about 6 years ago. 5 years ago.
5. Almost 5. Oh, god damn it.
Yeah, I guess Josh's first wedding, he didn't really have groomsmen.
I don't think I went to that.
Oh, okay.
So
That's why he didn't have. He
You
did have
tell me, Richard.
He did have groomsmen, just he didn't show up.
yeah. He had one fewer than he thought.
Yeah.
It's like fucking Case going to his wedding.
Shit was all asymmetrical. It looked terrible in the Catholic Church. Symmetry is very important to the Catholics.
To make up for the fact that I had like an extra like entourage of women that I wanted to be important to me that day, I just called it a house party and was like, hey, you're more special than everyone else. Can you just come early and hang out with me?
Could you call them wedding spouses?
I guess you could.
Okay.
If we want to circle back to that. So what happened while I was gone?
Oh, I was talking about the whole fear thing and talking about having to drive past the spot where my dad died all the time.
Oh my god. Well, that's not lighthearted at all.
And so
I thought you guys were just going to tell a bunch of jokes while I went and used the restroom.
Oh, we did.
I'm here for it.
but yeah, like just that idea of like all I can say, and Robert said something articulated it really well. Which what did you say? Like you,
all you can do is you can just mitigate what you can mitigate, right?
Yes.
And then anything external to that is going to happen or it's not, and you just have to be able to deal with what you can.
right.
Yeah.
So
'Cause-
facing fear, all that sort of shit. That's what we were talking about. So
When you're in a situation like we were in the early days of COVID, we didn't know we were going to still be talking about. I didn't think that I would be sitting at a table like this talking about the first year of the pandemic. Remember, everybody told us to stay home for 2 weeks. I thought this was,
So-
like a month-long problem.
So I'm gonna go ahead and bring up that subreddit again because I read somebody said something about related to it. So it's what's the guy's name?
Herman Cain
Herman
Award.
Cain Award.
Herman Cain Awards, and this is people posting typically like social media, threads over a period of time, typically of people anti-vax,
Anti-mask.
possibly racist, transphobic,
Anti-science.
whatever you want to say. Yeah, just generally pieces of shit, and it sort of chronicles their not so much rise, just their fall, and typically they end up dying at the end of these. End of these,
But not before they call on prayer warriors.
Thoughts and prayers.
Yeah.
Right before the GoFundMes, right? Yeah.
Those strikingly
it is
common occurrences.
Yes.
There.
So I've been a long-term follower because I'm a Reddit. Use Reddit all the time, but that's like pretty much the only like social media I'm on like most days. But yeah. So anyway, it's startling how much every post
Right.
on that subreddit is the same.
It's like they're following it's like they all looked up how to write their like resume.
They all have the
They
same.
all
They,
have the
they all have
same-
the same flow.
Yeah.
They all have the same flow. Like, this is bullshit. I'm not afraid. Blah blah blah. Here's.
It's like rhetoric. Holy shit. I think I need some help. Oh gosh, I'm in the hospital. Please pray for me because, God.
Yeah.
Now my family needs money because I'm dead.
And then everybody around them saying, "Well, what a great person! They would have given you the shirt off their back." And it's a shame they were so. Anyway.
Yeah. So what were you gonna say about it?
Yeah, what I saw about that was, people were arguing the validity of being, whether or not you should find that cathartic, and whether or not you should, to what extent you should celebrate that sort of thing or find joy in reading that shit. And
I don't think anyone finds joy in it.
I think some people do.
Okay.
It's the Schadenfreude thing,
Exactly. Right. Yeah. But one of the comments I saw was like, you shouldn't be thinking about it at all, really. It's just weird. And my response to that is, this is a weird fucking situation. That nobody should have to think about any of this stuff. When was the last time anybody thought about this kind of thing at this scale?
Never.
For this long.
Right.
And not with the tools that we currently have. By all accounts, the reason that the Spanish flu or that the plague was as bad as it was is because people didn't understand
Right.
why it was as bad as it was.
Right.
They didn't know how to avoid it.
You didn't know the mechanics of it. You didn't know the ramifications. You just
And
knew that
now
bad
we
things
have-
happened in certain circumstances.
And now we have not just the kind of people to figure out what's going on with it very quickly. We have a global network where the first 6 months of the pandemic, I remember the way we would decide how to treat people was some of my doctors would get on the WhatsApp messaging system
Right.
and talk to doctors that were in Italy or in other parts of the world.
It's literally like Independence Day, like calling Australia and Japan.
Seriously.
Like, we know how to bring them down, boys.
Yes.
God damn it.
That's how it felt. I went to my doctors and I was like, "Did your friends have
Real.
any good ideas?" Like,
That's amazing.
and that's how we
Fucking
would decide
incredible.
what to do. And like one of my doctors would be like, "Hey, my colleague in India is using XYZ drug and he's seeing a little bit of help. Let's try it," because we didn't have any water for the fire. And so we just had to try what we had to try. And the reason we're so angry right now is because now we have the answer and now no one believes us.
Right.
And I don't know how to communicate how upset that makes us. Every death that I'm seeing right now is avoidable.
Yeah. Like to insinuate that people like you signed up for this is just absolutely missing the point and shitty and insane.
I, of course, signed up to help people. I've always wanted to help people.
To help people.
Yeah.
Not for this is something
But
that
like
no one
not
signed
to
up
be
for.
like abused and
Right.
and criticized and told that I'm a liar and
Yeah.
Right. I mean, it's our, our friend Jet, he's signed up. So he was in boot camp when September 11th happened.
Man.
Like they thought they were lied to. They had to wheel in TVs to prove to them that it was really happening. So
Whoa.
So yeah, the military that he served in was different than the military he joined.
Yeah.
And so you can't
Okay,
really
yeah.
say that he signed up. Like he didn't sign up for for the invasion of Iraq. He didn't.
Afghanistan.
No.
The Iraq War was before 9/11.
It was not.
It was after. It's 2002 or 3, somewhere along. We talked about this last
You're
time.
wrong.
Anything else?
I think in Saudi Arabia.
No.
Yes, you're thinking of Desert Storm,
That's what I'm thinking of.
which was a full
the first Iraq War.
That was Saudi Arabia, I believe.
I thought they were in Iraq. I don't know about this. Where is Patrick Jet?
No, Desert Storm was like
Help
1990,
us, Patrick
1991.
Jet. You're our
And
only hope.
it was Iraq because we were defending Kuwait.
Okay, cool.
Yeah.
Anyway,
I know a little, enough to be dangerous.
when it comes to issues of foreign policy and military history, yes.
Yeah, we should
Not me. I'm not the one.
Anyway,
Jet,
Ask
call in.
Jeeves.
Tell us.
yes, there was there was indeed an Iraq war that happened after September 11th, Allison.
Is that where the weapons of
Yeah.
mass destruction were
weren't.
Yes.
purported to be and were in fact not?
Yeah. And
Yes,
now
okay,
and
you're
now
correct.
everyone's just like, "Oh, George W. Bush paints. How cool. How neat."
He's so cute.
Yeah, he's so cute.
In the current times, can you help but be quaint about those days?
It's a great way to say it.
The halcyon days of George Bush reading a
Right.
fucking storybook in a classroom,
And then being like, what the fuck?
Mission accomplished,
Like, we
and-
all gave him a hard time because he didn't actually know what the fuck to do because he was faced with a completely unprecedented
Yeah.
situation
Not-
while he was supposed to be reading.
Well, hold on. War is pretty precedented.
Listen, though.
There's a line you can draw there. I see what you're getting at.
What I mean to
Magnitudes
say,
are a bit different here, but yes.
what I mean to say is that oh my God, I feel a lot of pressure right now. What I mean to say is that Trump is a piece of shit and Bush was not the president that I would have voted for policy-wise, but he was not dangerous. Okay. Oh, we're going to have to edit all this out.
I'm not editing anything.
They're just different things.
They're different things, but you're right that
there is
look
a different-
for the quaint.
There is a
like-
difference of magnitude there.
I think I got it. I think I got it.
I think that Bush was predictably dangerous.
Okay, I think I can wrap this up.
Please
Okay.
help us. Where is Patrick? Call him.
So the difference is George W. Bush, perhaps, if we're trying to draw a through line here, if we're trying to connect this, which is risky fucking business anyway.
Yeah.
We're
in a minefield.
Because narratives are kind of bullshit. But I think what you're trying to say is that if we are forced to connect these things here, is that there was an unprecedented event, an unprecedented crisis during George Bush's presidency, and he accepted the validity of that and he overreacted. And that led to some very bad decisions, including the,
And
blah, 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 WMDs, and lots of people died.
Right. People around him were in a situation to take advantage of that.
Yes, and they did, and lots of people died.
Yes.
And that is a problem, and that is not forgivable.
Bad.
There is a difference, and so if you had to connect that to the president during the onset of COVID, there was an unprecedented crisis, and he did not react. He refused to react. He refused to do anything proactive
It's a good way to say it.
to acknowledge the reality of this crisis, to mitigate the spread of it, to convey the severity of it, the danger of it, and it cost people's lives.
And it continues to.
Yes, it absolutely continues to, because there's lots of people who are not political, like that. Their reason for being a COVID skeptic or being anti-vax or whatever is not affiliated with their politics. It's their personal, or it's their identity, it's their subculture, whatever. It's not because their leader told them to.
Right.
But there's other people that it's absolutely because of that.
Yeah.
And
I mean, arguably, his inaction did more to just damage people's psyches than it did to actually
I disagree.
allow COVID to kill them.
I disagree. Because if he from the beginning would have said, "Hey, masks. Hey, we're going to do everything we can to keep Americans safe. So I want everyone to wear masks. I'm wearing a mask. Everyone's going to wear a fucking mask." Then that would have made wearing masks valid. Everyone would have done it.
But I think that's what he's trying to say. He's saying that it damaged, that his inaction did the damage.
Yeah.
Oh, you said damage to psyche, and I'm saying no. It literally led to people's deaths.
Yeah.
I think you guys are saying the same thing.
No, I think I'm being a little more incriminating. I think I'm being a little harsher.
Well, I think he was getting there.
Maybe. Now I don't know what I was trying to say.
Okay.
It's gone.
Sorry, I'm trying to be like all of a sudden now I'm the mediator. I'm just trying to cover up for the fact that I don't know anything about foreign policy.
So anyway, it's not what I wanted to talk about, but I feel like that's a way to sort of connect those two events if we must.
If we must.
So,
But
all right.
What?
I had some things to ask you.
Okay, I'm ready.
Okay. So there were really, and this was sort of why I wanted to do this follow-up. Here we are, an hour and a half in almost, and we're going to get to the...
It's all right. We're all friends.
So the first thing I wanted to ask you about was when you have the onset of COVID, or when you look at an X-ray and you can identify that, oh, this person has COVID, what is going on with someone who is sick from COVID that is different than when someone is sick from a different respiratory disease or from the flu or something like that?
I'm thinking because that's a hard question because it's it's kind of a generalized question.
Well, I mean, feel free to reframe my question into something that makes a little more sense.
So
because I don't know if I'm asking the right question.
So the thing that is the most different about COVID, would that be helpful compared to other respiratory illnesses? The thing that's the most different about COVID?
Yeah. It's, why is COVID its own thing?
Why is COVID its own beast? Yeah. Okay.
It? Yeah.
It is very unpredictable. If I have a patient that comes in and is positive for the flu, if they're our age, I'm going to expect a cough, fever, chills, malaise. They're not going to have a bacterial infection unless they're an immunocompromised patient. They're probably not going to need oxygen. In fact, they're probably not going to need the hospital, which is why I don't really know what to do with them, because it's the flu and you treat the symptoms. You take Tylenol or Motrin for a fever and you stay hydrated and you rest and you get past it. If the three of us go in and we're all COVID positive, I feel like I'm not close enough or not far enough.
You're fine.
And we all go in and we're COVID positive, and just all three of us at this table are vaccinated. But if we weren't, our courses could be remarkably different, and there's absolutely no rhyme or reason to it.
So let me see if I understand what you're saying. Are you saying that there's just not a lot of ways to predict how COVID is going to
affect each person? Right.
Okay.
And so each person that comes in the role that I play, by the time they come to me, they have already been sick enough to be hospitalized. Mm-hmm. But once they are in my care, in the intensive care unit, I don't have a good way to predict if they're going to do well or if they're going to turn a corner and get better. And they can get suddenly worse. Like their oxygen levels will just drop precipitously, like off the side of a cliff.
So it's just very volatile.
It's extremely volatile. And
Also, you mentioned us all being vaccinated, but are you speaking from a baseline of being unvaccinated?
correct.
Let's
This point, the majority, an overwhelming majority, over 98% of my ICU is unvaccinated patients.
Right. And I guess like I'm trying to understand what is the difference between and not in a snarky way, like not in a shitty like gotcha way, but there's a difference. Or I mean, because I don't know, like is COVID just like the flu but more volatile?
So here's what I think I actually should say is that if you have the flu, or if you have a bronchitis, or if you have rhinovirus, or if you have any other upper respiratory sinus infection, you can count on those symptoms being respiratory.
Okay.
Cough, cold, flu, whatever. COVID is a disease of the lungs. It could cause pulmonary symptoms. It makes you short of breath. It gives you a cough. It causes horrific pneumonia that is not responsive to our general treatments for pneumonia. But this is what you came for. This is why I was here. COVID messes with every organ system of the body.
And why is that?
I don't know.
Is that related?
We don't actually know yet, but we know that a lot of it has to do with the fact that it also is extremely damaging to your vascular system, which means your veins and your arteries. So one of the most common side effects of COVID is blood clots, because it can cause damage to your vascular system. The veins and the arteries in your kidneys are pretty small and are very sensitive to things like that. You can get a renal failure very easily. You can get blood clots in your legs, in your arms, in your lungs, in your brain. Strokes are extremely common with my COVID patients.
Right.
Heart attacks. Blood clot inside your vascular system of your heart is a heart attack.
And so why is it considered a respiratory virus because that's its onset?
Primarily, yes, because that is the way that it is spread. It's spread through droplets, which is
you don't really spread heart attacks.
No, you can't. A heart attack or a blood clot in your lung isn't contagious.
Because you're not. It would they would be if you were sharing blood with people.
But the inflammatory cascade,
So your immune
system response and what we call the cytokine storm is so
Sounds
bad.
fucking badass, honestly.
It's so bad that it causes it causes multi-system organ failure. And once I diagnose you with multi-system organ failure, the chances of you living a life that you lived before your hospitalization are reduced significantly.
Yeah.
Multi-system organ failure was on my mom's death certificate. It was on my mother-in-law's death certificate. It's not a thing that you recover from well. And this week, and one of the reasons that I decided I wanted to come back in here today and get in front of this microphone that I don't really feel comfortable being in front of, is I learned that during the Delta surge at my hospital system, the place I work only, that's where my evidence is coming from, we have not successfully gotten a patient off of the ventilator since Delta has been the dominant strain.
Wow.
And that is very sobering.
And what was the rate of extubating before?
I mean,
because it was pretty low.
To be
before.
fair, it was very low, but here and there, every once in a while, we would have a really good success story. We would at least get someone off the vent for a little while. Mm-hmm. It was at least in the realm of possibility. And this week, I realized it's really been off the table, and we haven't done that.
And just to clarify, because not that I think anyone who would listen to this far would still be would be on this train, but maybe they know someone who has said things like this, is that this doesn't mean that intubating someone is what kills them. It means that the people who get so sick that they need intubated are already very sick.
We are at the point to where when we talk to the patient and the family members of the patient that we are going to intubate, we tell them that there are two outcomes. One is that the patient will die, and the other is that the patient will survive in a way that is nothing like the life they had before the hospital,
Right.
where they are requiring permanent life support, generally either from a ventilator or at least from a trach with an oxygen supply and a feeding tube. And there's a high likelihood that they will have lasting effects that prevent them from ever being home again with their family or interacting with their loved ones. That's what we are now presenting as the two choices. And because of that, we actually have a higher number, not a ton, but a higher number of patients that are electing to not be placed on the ventilator. And it's a relief for us as providers because it takes away the last couple weeks of futile care.
Right.
What I've struggled with the most as a critical care provider is the reason I like critical care is because I get to bring people back from like the brink. Like you get to get almost dead or even dead, and I can like pull you back from that, and I can make you better, and I can put you back home with your family. I haven't done that in a long time.
Yeah.
I don't get to put people back with their families when you have COVID.
Or when you get sick enough with COVID to be in the ICU.
Yeah, once you, that's sort of what it sounds like. It's, you know, at your hospital.
It feels like I
specifically,
could stay home and the outcome would be the same.
Yeah, once they get to that point, it's already too late.
It is.
Right. And it's a strange thing where it's almost
like I'm going through motions now, pretending like I'm going to have a positive outcome, and we're just not.
It's almost as if y'all did too good of a job for so long that people just expect y'all to be able to just keep people from dying no matter what.
Well, we're not witches.
You're not?
I mean, I want to be.
Oh, okay. Someday.
I mean, I think there's a big gap between a normie and a, I don't know, man. Like, I think you can be a witch without having the ability to literally raise the dead.
That's a necromancer.
Correct.
The truth
Correct.
is
Let's
is
get
that
our fucking terminology
the truth
right.
is that I've brought a lot of people back from being dead, and it is
You're fucking witchy as
you're
fuck.
it's
You're a
a
necromancer, yeah.
high ass feeling too when you're like, you were dead and now you're not. Like, that's impressive.
Right.
I will say we did have one success story. He was the patient was pre-Delta, but that patient left us requiring a permanent ventilator and a feeding tube.
Yeah.
And that patient came and visited us a couple weeks ago
That's nice.
on his feet. Oh, there it is again.
Wow.
Whatever. Who cares? It's a man. The patient survived.
Oh,
The patient made it past.
Brought to you by
Hippo. The patient survived. It's because the patient was a man that he survived.
What?
Whoa!
Just kidding. I'm just kidding. I was trying to make a stupid joke.
Brought to you by Four Hymns.
Were you throwing some extra blood into his dong? Is that why he came back?
It was Robert's blood.
Because
Whoa!
I feel like in Texas that's a violation of our marital vows. If you inject blood into another man's
What
penis,
if it's his own blood?
To save his life?
even yeah.
But I took it out of like his arm and put it back into.
Doesn't matter. It doesn't matter.
That was a pregnancy, according to Abbott. If you get to an erection, you're basically pregnant.
Yeah, you're
in the state
you're
of
a
Texas.
fucking serial killer.
So does that mean if you get a vasectomy, are you...
Or what if when I just have a period, when I like, what if that egg goes to waste?
How many counts of murder is that?
Not
Plenty.
many. Not many for my barren ass, but
Plenty. You don't have ass ovaries?
Those are hemorrhoids. Please.
So one of the funniest things I've ever heard a person say was in junior high,
oh,
and it was this motherfucker across the table
This
from
guy?
me.
What? Really?
Yeah,
what did he say?
So we
I don't remember this.
we
so this
didn't
would be great.
have too many. We didn't have too many gangs, but we had a few girl
There's
gangs.
some gangs, though, you know what I'm saying?
And whatever that means, just like groups of people that would decide to beat each other up. But these girls,
Like actually physically interact, like with fists, because we had cliques and like girls that would fight, but like with not like
oh no, like I'm talking like on like full mount, like
punching each other.
Yeah.
Holy crap! Okay, go on.
Where the fuck did you go to school? Anyway,
In the hill
in
country,
like fucking Rainbow Bright fucking land. I don't know.
yes, basically.
Anyway, so these girls are fighting, and everyone's kind of just gathered around watching. And this fella across the table from me, because he's very contextually aware, he's not gonna just say like kick her ass, because these are girls. And so he says, kick her in the ovaries,
I did say that.
smash her fallopian tubes.
I said that
Did
as
you
well.
say that?
I did.
Would you go from the front or back though? Just a poll.
That's up to them. That's not... I was not giving those specific directions.
So anyway, speaking of ovaries, you just kick the ovaries right into the ass. You kick them so hard they
Listen,
go
the
into the
ovaries-
butt.
The ovaries are a lot smaller than you guys think.
I don't know.
I don't know.
And that's why
why
I am running for senator.
Why didn't you say like kick her in the cooch? That's got a nice like.
We didn't use
kick
that
out.
word.
Oh, you didn't?
No.
We were gentlemen. Please.
Were you?
Were we?
We're gentle boys. We're gentle boys.
They call those soy,
Who were you
soy boys
rooting? Who
today.
were you rooting for?
I don't want to... I remember one of the people who it was.
Yeah, tell us.
Micah.
Micah.
I think.
That's a boy's name.
Not for this girl.
She's not listening.
Micah, call in, please, and tell us what you think about that.
Why don't we have like a person over there who's like manning the phones?
The switchboards would be lighting up.
Like Delilah.
I'm pretty sure her name was Micah.
Well, there was Cassandra, just so I remember.
Maybe these are different fights. I might be imagining different fights.
There could have been multiple fights. I may have said this more than once.
What were they?
This is
what
your
were they?
go-to. This is your catchphrase.
What were they fighting about?
Man,
What does anyone ever fight about in junior high?
I don't know.
What does anyone ever fight about?
politics.
Anyway,
I don't know.
Just mad about the state of the world.
Bill Clinton's a liar. Yeah, no, I don't know.
I don't remember.
I don't know why shit pops off. Especially with 8th graders.
Yeah,
But
I think it was high school.
it was not. Definitely was
Must
not.
it was definitely two different fights then.
Okay.
I'm glad that he has a catchphrase for lady fights.
Smash her fallopian tubes.
I don't see as many as I would like to be able to bust that out.
Would you yell that at like a women's UFC?
No, that's what they're there for. I don't even need to tell them.
It's a little. They
They signed up.
They
for
signed
that.
up for that. Absolutely.
they got their black belt and ovary kicking.
Yeah, totally. I say that to them. I'm gonna get my ovaries kicked in.
Here, will you hold these, please? Cacao.
Right.
I'm gonna let you borrow some. So back on track. Not that we were off track. These are the tracks. Get fucked. So the difference between COVID and other quote unquote respiratory diseases is just, it seems so it seems like
COVID, once you get to my ICU, is a very systemic illness.
systemic.
Systemic. It's your entire body system. I have to
see.
worry about everything. I have to worry about your brain. I have to worry about your kidneys, your liver.
So I know part of the thing about COVID in general is that it is your one aspect of it is that your immune system will overreact.
Yes.
And is that the same for other systems of your body as well? Do they overcompensate?
Well,
Or are things just getting that bad for all of them?
it's more like
Or does it vary too much to say?
it varies quite a bit because,
Okay.
I mean, like I said, we haven't been able to predict this as well as we predict other things.
Mm-hmm.
But it's more like the immune response leads to the failure of everything else.
Right. Okay.
Because when
Okay.
your immune system goes into overdrive, it becomes very bad at defending against everything else. So you are more prone to a bacterial infection, or you're more prone to a fungal infection. I have treated more fungal blood infections in the last year and a half than I have in my entire other...
Wow.
Like, why are people growing mold in their blood? What? Like, that's just a thing we deal with now.
It's a different metal song.
Yeah.
So are
maybe
you
that's-
telling me that Simpsons meme is incorrect?
What?
Like with Mr. Burns? Like where he's goes where so
He's-
there's an episode where Mr.
Where
Burns
he's
goes to the
so
doctor.
sick that he's well or something?
Right, and it's like, well, you see, when all these germs try to get through at the same time, none of them can get through.
Oh yeah.
So I'm invincible. Well, no, a small breeze could invincible.
Yeah.
So you're telling me that that's not accurate?
Correct. I mean,
Motherfucker.
well,
Been lied to.
the things that I am witnessing as a provider that are the most common complications secondary to COVID are renal failure, often requiring dialysis.
That's your kidneys, fuckers.
Oh, sorry.
It sounds like something way different, so I can
Yes.
I can see that. It
It's
could
not
be
called your kidnal system.
It's your nephrology. Nephrology.
Why is that a different
I
word
don't
too?
know.
Why can't you? Why do you have
is this so
why is
different?
it- why don't you-
Nephrologists are the renal
Why-
doctors,
yeah.
which are the kidney doctors.
Why don't I have my Rindies and my renal failure and my
Listen,
renologist?
Almost everybody with COVID gets dialysis at least once. Not everyone, but it's
Should be
close.
called renalalysis.
And they
Renalysis.
also have what we call hypercoagulability, which is the
blood clots.
the increased likelihood that you will form a blood clot. That could be in your calf vein, it could be in your femoral vein, it could be in this arm over here, and it could be in your brain, it could be in your lungs, it could be in your heart. So we have to treat everybody with high doses of blood thinners generally, which leads to the risk for bleeding. So then sometimes they have bleeding and blood loss, and we have to chase that. We're
Right.
basically chasing our tail with every system when it comes to COVID. Whereas if you just have like a pneumonia from like, I don't know, like whatever you get pneumonia from, like fucking H flu, then Haemophilus influenza, which is different than the regular. Forget it. I'm digressing.
Well, so going back to the immune system response,
Yeah.
a heightened immune system response, is that something that COVID is doing to your immune system, or is it because it is an unknown entity to your immune system?
I think it's the second thing.
Like it doesn't know what to do yet.
Right.
Right, because
Right.
if you're vaccinated, it knows what to do.
That's the major difference.
Right.
And that's also something that I wanted to touch on was that there's a lot of rhetoric going around where people saying there's no point in getting vaccinated because you're still able to spread COVID.
Mm-hmm.
That statement in and of itself is true. That
Sure.
if you are a vaccinated person and you contract COVID and have a breakthrough infection, you can spread it. Your viral load will be lower. And the likelihood of you developing a lower respiratory tract illness is much, much lower. And that means lower, deeper in your lungs, which is what causes pneumonia.
Okay.
So it's just much more likely that as a unvaccinated person, you will have a higher viral load. You will be more likely to spread it. And
is this an unvaccinated person who has already had COVID as well?
No, that's a different animal. So
okay, then you can address that.
Yeah,
later.
but I kind of lost my.
Sorry.
No, it's okay. We were talking about.
You're talking about viral loads, and so I think what
and we were talking about COVID causing the immune system response versus.
Hold on. I think what you were fixing to finish up that thought with is you were talking about lower respiratory, and so a higher viral load, and so people who are vaccinated and experience and do contract
most
COVID,
of it's all up here.
right? And is that called an upper?
Yes, that's called an upper respiratory.
Respiratory infection.
That's
Right.
your like sinuses.
Sinuses,
Okay.
like maybe the back of your throat.
And so those are
Yeah.
things that you will not get pneumonia from that.
No, not typically. No,
And
you're gonna
so-
feel crappy.
right, but like a sinus infection.
Sure.
Right.
Maybe
And
a cough.
And your viral load is
Sore
smaller.
throat.
So even though you can still spread it, you are less contagious.
And
Correct?
correct.
Okay.
You can still give other people COVID. However, the likelihood is lower because what happens when you get COVID as an unvaccinated person is the virus starts replicating in your body and now it's everywhere. So when you just like take a breath, it's like coming out and it's
So you know, if you're vaccinated, so let's get down to brass tacks. If you're vaccinated and you had a breakthrough infection, to give someone else COVID.
If I'm vaccinated and I walk into HEB and somebody who has COVID breathes it into me, it's going to come in through my nose and my mouth, maybe because I'm wearing my mask, but say I'm unmasked, it's going to come in and my body's going to be like, I have seen this motherfucker before, and it is going to send out the antibodies against that spike protein, which is on the surface of the COVID virus.
Mm-hmm.
And it's going to fight it, it's going to deflect it, and it's going to send it away. For the alpha variant, I'm not even going to notice that I walk by this person, like the OG COVID.
Mm-hmm.
For Delta, it's getting around it a little bit, and I might have a breakthrough infection, so I might have like a low-grade fever, I might have a cough, I might feel run down and tired, and I might test positive for COVID. It's very likely that I won't require further treatment past like symptomatic management.
Mm-hmm.
But if an unvaccinated person encounters that person that spread the COVID, their immune system does not have immunity to that. And
Yeah.
that is one of the other things I wanted to touch on is there's a lot of language being used in the world about, quote, natural immunity versus vaccinated immunity. And there's a few ways that that language is being used. One of them is that there's natural immunity, which is just the immune system that we have, that we were born with, the one that our body uses to protect itself against everyday illness. And that immune system is pretty good in a robust person who doesn't have any underlying health conditions or any other problems.
Yeah.
But what has been proven over the last year and a half is that COVID is really good at fucking that up and pounding it into the ground. And it overwhelms the immune system and it keeps it from doing what it needs to do. The other way that people are using the phrase natural immunity is when they talk about infection-mediated immunity, which is when you have already had COVID and now you have some antibodies against the virus.
Right. And so
And that-
infection-mediated immunity.
Right. Which means that you've had the infection, you have developed the antibodies against it, and if you were to be exposed to that infection again, your body would already have the tools to fight it. It's the same school of thought that back in the 80s when our parents would have like the chicken pox parties where it was like just get it over with, like because we didn't have a chicken pox vaccine when we were kids.
Yeah.
So it was like, oh, thank goodness she got it over with. She's only 2. She won't remember. It was a fever. It was a rash. It was no big deal. It's done. Now she has the immunity. We move on. One of the things that's been so frustrating trying to talk to people that are against vaccination is that the concept of infection-mediated immunity and vaccine-mediated immunity, they're almost identical. The vaccine is just giving your immune system a very specific blueprint to make protection against COVID without making you nearly as ill. So what...
without you having to take the risk
right.
of it.
So,
and also, it does give you more
it does.
antibodies.
Because it's more robust, because it's more specific. Because most of the people that are claiming immunity from COVID are probably had the alpha variant.
Right. And those antibodies are going to...
They wane over time.
Yeah, they don't last forever.
Natural antibodies do, in fact, wane over time.
Right.
Like you're going to have to keep re-upping and
just like you'll need to get
COVID.
booster shots eventually.
Sure. Maybe. An example of not needing booster shots. It's like a storefront. Booster shots. It's like your like hepatitis. Like when you're a kid, you get like 3 hepatitis. You get a series of immunizations when you're very little, and then a little older, and then a little older, and then you never need it again unless you're like a person that's traveling to a foreign country and you get your titers checked. I had chickenpox when I was like 2 or 3, and I never got the chickenpox vaccine because of that. But then at some point during my career, I was checked by my hospital to see if I had varicella titers that were high enough to protect me against varicella. And they said, oh, it's kind of low. We need to give you this vaccine. I said, yeah, sure, go for it. They wane over time. So like if you were to go get your like measles, mumps, and rubella titers checked, they might be good, or they might say, oh, well, if you're going to be exposed, you need a booster.
Right.
So as a healthcare provider, they check me because I'm interfacing with these illnesses a lot. But if you're not, you don't really get those titer checks. That's not a thing that happens.
So for the hepatitis versus, say, COVID or any other things, like, is there something specific about the hepatitis antibodies that causes them to last for a much longer period?
I think that it's basically just teaching your body a thing to make, and it just becomes a part of that natural, quote unquote, immunity that everybody is so hell-bent on relying on, is that it teaches your body to understand that the same way it would if it encountered chickenpox in the wild.
Right.
It learns things. It knows what to do. It figures it out, and it changes. It's adaptable, just like the rest of us. And it's so frustrating because our immune system is responsive and it is smart, but the overwhelming data is that COVID is able to overwhelm it.
Yeah, I think another part about that immune system, what was the terminology for it? Immune system protection versus...
infection-mediated immunity versus vaccinated.
Go. Yeah. So for infection-mediated immunity,
you have to go through an illness to obtain that.
Exactly. Like while that is happening, while you're building those antibodies, you also have COVID.
Right.
Which is a problem for your immune system.
The argument that we're hearing from people who don't want to be vaccinated is that they would rather have COVID to avoid getting COVID, which makes no sense.
Absolutely not. Yeah.
Oh, right. And it also, the thing that really bothers me about that particular stance is that people are able to say this from and advocate that policy from a position of no risk, because if you were to advocate that policy, think that through, you would understand that what you're saying is that all the vulnerable population should just be exposed to COVID, and whoever dies. And that's a very, I have seen some people actually own up to that.
Sure.
and say that like, yeah, that's what I'm saying, strong, basically
There's
only,
a lot of
Survival of the fittest.
Yeah,
Yeah.
there's a lot of that language going around. Play stupid games, win stupid prizes, kind of stuff.
yeah. And
Well,
But
anyway,
it just brings everything down on its way down.
it's in a weirdly different light. That is what's happening. Like the fucking subreddit. Like the problem is saying that you want that to happen to people who are, say, immunocompromised or the elderly or whoever.
Right.
That's not their choice.
right.
Whereas what we're seeing with people who are choosing not to get protected against it, that is a very
Well, it's strange, right? Because it's like if you want to try to put that evolutionary lens on it,
right.
there's sort of there's biological adaptation and then there's behavioral adaptation. And
Yeah.
like our behavioral adaptation to be able to assimilate new information into our worldview and to trust the collective knowledge of the human race, which is science, a collective public testable knowledge, has allowed us access to vaccines, which greatly increase our likelihood of survival. That's a behavioral adaptation in a sense.
The success of this
so-
COVID vaccine is completely unprecedented.
And
It's
so-
it's incredible. I just
Yeah. So anyway, yeah.
sorry, I
but
didn't mean to interrupt you.
Oh, that's all good.
I just really wanted to like be like a hype man for like the COVID vaccine. Like it's
Right.
doing so good,
Yeah.
and it would
it's
be doing
ridiculous.
so much better if this was.
Yeah, it's frustrating. It's a mess. I'm gonna try to take us a little bit out of the COVID weeds, if that's okay. Is that all right?
It doesn't feel great being there. So yeah, let's go somewhere else.
That's just my life, so sure.
So, if you feel up to it, there was one more question or thing I wanted you to riff on,
Okay.
and that is so I'll set it up. There's sort of two parts to it. So, because I've heard you talk about this concept a lot, which is that the poison is in the dose,
Oh yes.
right?
Mm-hmm.
And so there's a lot of people. I actually came across a name for this. It's sometimes referred to as chemophobia, and this isn't like a legit phobia. This is sort of, it's just a way to
Just a name for this occurrence,
yeah.
this phenomenon. There we go.
Right. And so it's people who are afraid of anything that is a quote unquote chemical
Which of course is
is fucking everything.
all of us.
Yeah, is everything. Literally everything is technically a chemical.
That's-
I guess technically atoms are not chemicals. So, but once you get to like,
Cellular level.
or before that, honey,
I'm a biologist. I don't know.
fucking water is technically a chemical. So,
You can overdose on water.
and so there you
And
go.
that's really what I really like to talk about when I talk about poison is in the dose.
Right.
People are adverse to a lot of things because of quote unquote chemicals or because of quote unquote toxins or quote unquote poisons. There's a lot of things that we know are poisons. There are the things that are very obvious poisons. Arsenic. You don't drink bleach.
Right.
You don't,
Right. Yeah. And
there's
and
just
there-
stuff
and-
that we know that is poisonous regardless, that has the like
Right.
symbols on the side, the stuff under your sink.
Right. Then there
All
there
of those
are
things.
there are naturally, I don't know if y'all know this or not, there are naturally occurring plants that are also poisonous.
Oh, extremely. Oleander is one of them.
And these are natural.
It's just ones off the top of my head.
These are natural.
Mother Nature put those there.
Salvia. I think you can smoke it and you get something. That goes back to
It's like fake weed, right?
Yeah. That's like the first part
Oh
of our
yeah.
of the
yeah.
the pod.
Not to be confused with sativa, which is something different.
That's
maybe
a,
that's what
that's
I'm
a
thinking
strain of marijuana. No,
Right.
salvia is like something that they used
Maybe
to
I'm
sell in
confused.
head shops.
Yeah.
It's also a bush with pretty flowers.
Moving on.
Moving on. Literally anything can be a poison if you dose it correctly. And that's one of the most frustrating things that I see. It's a really big part of the language used in like the food safety industry. They like to talk about pesticides. There's this organization that's the Environmental Working Group or something, EWG, that talks about the dirty dozen a lot, the people that use all the pesticides. And what they really do is they just list the pesticides that are used, but they never talk about the dose. And the dose is really important because when you actually look at what pesticides are used on the produce that people are so worried about coming into their homes and their lives and their mouths and their kids' mouths, the dose is consistently well below the accepted high level. Pesticides are used in organic produce as well. That's not something that people are really aware of. The word organic is very insidious and
It's very loaded these days.
It's very loaded.
Yeah.
It's generally marketed towards, it's just a marketing ploy. But I don't want to digress over into nutrition because I'm not a nutrition expert. I'm not a food scientist. But what I will say is that the poison is in the dose. That phrase to me is really important because you can overdose on almost anything. You can take something as life-giving and important as water, and you can absolutely drink too much of it, and it's called freshwater drowning.
Right. Yeah. And this is different. This is not suffocation.
No.
Like,
No. You can just drink so much water that you create an imbalance in the sodium and the chloride levels in your body that you die.
Yeah,
you can drown on dry land if you drink
you're
so much water.
Engorged with water.
You have hypovolemia, hyponatremia, and it can cause you to die.
Right.
You can overdose on, people talk about poppy seeds having like they're the seeds from
It's that Seinfeld
poppies,
episode.
and opium is created from poppy seeds. Opium is, of course, opiate. It's a narcotic. It's where morphine comes from. If you eat a poppy seed bagel,
Lemon poppy seed muffins are fucking
they're
so good.
very delicious.
Oh, man.
It's not going to cause you to die from an opium overdose. If you took like 16 bottles of just straight poppy seeds and ate them, you might test positive for opiates on like a drug test. I'm not sure if you would die. You need a lot of that to die. The dose is so important.
Right. And so this concept of the poison being in the dose, it goes both directions as well.
It does. It absolutely does.
Because a lot of times you hear people talk about maybe mercury
Oh, yes.
being present in something.
Sure.
Yeah,
And
fish.
so, right.
Mercury is naturally occurring in a lot
or
of
maybe
fish.
is mercury or some type of mercury compound used as like a binding agent in like some type of vaccines or some
used
types
to
of
be,
shots?
and it's not anymore. And that's
Okay.
one of the big things that anti-vax community likes to talk about. But it's no longer actually put in there, so it's kind of a moot point. It used
see.
to be at a safe dose. It's been removed. But they
because
still
there's
like to talk
probably
about
something
it.
that can just do the job better.
Yeah.
I assume.
Whatever it was.
So, well, maybe that's not the best example, but I guess like what I'm getting at is that, you can have something that is absolutely a poison and is used as a poison. That
arsenic, for example, is present in apple seeds.
right?
But if you ate your entire apple, core included, you won't die. Arsenic is also present naturally in rice.
Mm-hmm.
I'm not sure you can eat enough rice to die from arsenic poisoning.
Right. Are there any examples, or like, and then also I think what's important is that this concept of that if you have the right dose of something, and I feel like you can kind of balloon this out and make sort of a reductive galaxy brained sort of truism of it if you wanted to, but that the proper dose of something can be medicine, but whereas too much of it can be a poison.
Yeah, absolutely.
Right.
Potassium chloride, first one that comes to mind. Potassium chloride. The normal level of potassium chloride in our blood on a day-to-day basis is somewhere between 3.5 to 5.5 milliequivalents per deciliter. It's a pretty tight window. It's pretty small. If you go well below that or well above that, you're risking cardiac arrhythmias, you're risking death. Plain and simple.
Right.
And potassium chloride is what is present in the injection that they give people for the death penalty. because it
Right.
kills you so quickly and so efficiently.
Right. So
Potassium,
it's a thing.
I'm sorry. I just get so excited when a patient has like hyperkalemia, cardiac arrest, because I know exactly how to fix it. I know exactly what drugs to give to like reverse the process and pull all that potassium back and pull it back into the cells where it belongs so that it's not fucking with the like.
Do you have to? Is there ever instance where you have to give that?
Oh, of course.
Okay.
Yeah, absolutely. Somebody can come in with a potassium level of 1.9 and be on the verge of dying, and I need to get them back to 3.5
And
as
you
quick
give
as
them
possible.
the same thing
Yes.
that you would give someone on death row to kill them.
Yes.
But you just give it in a smaller dose.
I give it in a slower rate. It's the rate that is so important.
Okay. So
In our ICU, we cannot give more than 20 milliequivalents of potassium intravenously per hour. I can give you like 60 orally because it takes a long time to absorb. That's getting into pharmacokinetics of intravenous versus oral, which is not the point of this podcast. But if you give a drug IV, getting all excited, I'm knocking my headphones off. If you give a drug IV, you can assume that the effect is going to be pretty quick. So it's not just the dose. I mean, dose is involved in rate, but 20 milliequivalents per hour is considered the safe, acceptable rate to replace potassium.
right. Well, the rate is part of the dose.
Exactly.
You know, and it's not just a quantity.
Correct.
Like your time. Your time is in
Yes.
your per. Your per. You need that denominator.
If I push 80 milliequivalents of KCl on a patient, I'm effectively killing them. If I
Right.
give them 20 immediately, I might be saving their life.
Right.
So it's
and then I
it's
guess and
close.
if you give them 20 every 2 hours.
That's exactly what I do.
Or something. See,
exactly
I
what I
could
do.
fucking do your job.
You're a doctor.
Just pump my fucking dick full of blood. Let me at it.
Is that all you need to do?
It's all you need. You either need to be a woman with like however many bazillion years of education, 8 years of education, or you
Post-high
just
school.
need to be
Or just a man with an erect penis for
and
many hours
confidence, baby.
and confidence.
You just need to listen to a few podcasts, get that confidence going, get someone to throw some blood in your dick, and you're ready to medical.
Oh.
But yes, I mean, if I give calcium chloride too quickly, I can kill you. If I give calcium gluconate, much safer.
Yeah, and so
it's just the way, it's just chemistry, and I'm sorry that chemistry offends people.
sorry this shit is hard and that it has subtlety and layers. I'm sorry it's a fucking science, assholes. Yeah, and I guess it's sort of
I can give you 12 grams of magnesium and you're probably going to survive but have diarrhea. If I give you 80 milliequivalents of potassium right now, I'll kill you. Like, it's just
right. And
and it sounds so boring because if you just like take too many vitamins, it's like, what's the big deal? But you have to know which vitamins are involved in like fat solubility versus like water solubility.
I mean, it's also
Sure.
it's like the magnesium is a very mundane example too, right? Because it's like, what is the stuff called that you take for like it's a laxative?
Oh, magnesium citrate?
Yeah.
Yeah,
You
makes
just
you
take
shit
that-
your face out.
Yeah, you just take that when you're constipated.
Sure.
And that's a thing that you just do. That
Uh-huh.
milk
everyone-
of magnesia or whatever.
There you go. Yeah, yeah.
Oh, okay.
There's a brand name, but I can't remember what it is. Is it Mylanta? Is that what it is?
Mylanta, maybe.
I don't care.
I don't care.
Anyway,
Malox.
Malox is heartburn.
You're a heartburn.
I know.
Oh, that was so sweet. Anyway, yeah, this is a very mundane example that everybody does and has
Right.
done, you know.
Or like if you like are like, yeah, I take calcium from my bones, like no big deal.
Yeah.
But if I deviate from calcium chloride to calcium gluconate in my like prescriptive authority in the hospital, I could end someone's
kill
life
people.
accidentally.
Right. And if I was to so people who use this rhetoric and throw this rhetoric around, what's frustrating is that they really seem to be infatuated with these ideas of it's very black and white, it's binary, and almost they're infatuated with these ideas of almost like purity in a sense. Like I don't want to drink that water that's been made impure with fluoride. I don't want to I don't want to do this. I don't want to do that. And so it really, and so like I don't want, it's just absolutely against how medicine works in this concept. It's against this concept that poison's in the dose, because it says that I don't want any of that, because if any of it is poison, if any dose of it is poison, then all of it's poison. I don't want any of it.
Right.
And
that's what's so frustrating, because
don't put any pesticides on my, don't put any pesticides on my this. Don't don't put any chemicals in my body, because chemicals in a high dose can kill you, and never mind, and so small doses are just going to kill me slower, but chemicals always kill. It seems to be the assumptions that they're working from.
Right.
And it neglects this. This is the correct axiom that poison is in the dose.
Like when you hear about the opioid and the opiate crisis, and people that are taking narcotics recreationally, if you come to me with chest pain and some shortness of breath, one of the first things I'm going to do is give you morphine, because it vasodilates, it relaxes your blood vessels, it delivers oxygen to places that it wasn't getting to before that. We actually are using it a lot with COVID, because it's allowing our patients with air hunger. That's what we call our COVID patients. They're air hungry.
Are they breatharians?
They're air hungry.
This is a thing. Hold on. You're laughing like you think that I'm making something up right now. I'm not.
I was just going to say they're oxygenarians.
That's a better name.
Wait, are these?
We'll Google it later.
I don't know.
Sounds like a episode of
like Futurama, really.
No, I was gonna say that show. I can't remember the name of it. Based in Seattle.
Frasier?
No.
Friends?
No, after that, Seattle, like with Fred Armisen.
Oh, Portlandia.
That's it. Thank you.
Was that Seattle? That was Portland.
Yeah, I'm pretty sure that's in Portland.
Not Seattle. It's the
Not
Pacific
Seattle-landia.
Northwest.
I'm going to go with Frasier on this one.
Sorry, Farron. I know that you live in Seattle, and I had that wrong. Portland is in Oregon.
Not even the same state.
What did I tell you about foreign policy? I live in Texas. Portland is basically
Also,
foreign.
Not a different country.
Close enough.
Have you seen the weirdos in Portland? May as well be a different country.
Listen, my friends in the Pacific Northwest can walk to their dispensary to buy their weed gummies. I do live in a different country from that.
Texas is about the closest to a different country.
I can't take birth control right now because I might go to jail because I haven't had my period yet.
The thing that we both have in common is a long history of systemic racism, both of our illustrious states.
That is true.
Yeah, like I think that Portland, like Oregon, was like the only state to actually outlaw black people living there. Something like that. So anyway, that's a whole other can of worms, guys.
Yeah.
That's a different pod.
Yeah.
Some egregious shit in the history of Oregon and the Portland area. Anyway, breatharians, oxygen deprived.
Thank you.
Hit them with that morph.
Right. So if I give, but we're not talking about COVID. If you come into me with if you're having a heart attack and I give you morphine, it's going to open up your blood vessels. It's going to get more oxygen to your heart. It's going to make you feel better. It's going to relax the rest of your body. It's going to let you breathe easier. It's going to help you. If I give you somewhere between 2 and 6 of morphine, 2 milligrams to 6 milligrams of morphine, that's what it will do for you. If I give you 14 milligrams of morphine, I'll kill you.
Right.
Yeah.
Right.
End of story. It's just, I don't know why there's this, what do people that are so caught up on chemicals and poisons and toxins, what do they think we're doing in the hospital? Do they think we're just waving wands around and
Not only that, but it really betrays the whole way of thinking that you're describing. It really betrays just a lack of understanding of the world around you in general. Like if you're walking down the street and a car goes by, you're gonna breathe in exhaust.
Right.
You may not see it coming into your face, but it's happening.
Yeah.
So what then? You're not breathing pure air.
Of course.
Are you just
Right.
gonna kill yourself? Right? Are you fucked?
What if I told you that the percentage of oxygen in this room was only 21%?
I'd start choking to death because
Right.
now I know.
But that's what we call room air in the
Yeah.
hospital.
Yeah,
Right.
21% is perfect. Like
Sure.
it's just
Yeah, you just
Yeah.
don't. Like,
the rhetoric of
the,
like
the things that you choose to focus on and pick out and worry about are so seemingly arbitrary.
Yeah. And I mean,
a
and
good-
to
good
me,
way to
it
talk
also
about
sort of violates a bigger, just sort of a kind of contextual intelligence, or contextual awareness, or just an acknowledgement that there's not really anything that's true all the time everywhere, right?
Yeah.
Because if you take like an education format, right? There are certain coaching or teaching techniques that are going to work in an MMA class that are not going to work in a college lecture. Like,
Right.
and they shouldn't, because they're different things. And so
They're both teaching, but
Right.
they're different things.
yes, they're different things. They're different environments. There's different contexts. There's different issues going on. So someone coming in for a heart attack versus someone coming in for something else is going to need something different. And you're going to have to, well, what are their actual potassium numbers?
Right.
What does this individual person need? I mean, when I was teaching at a music school, I would each student is different, and what each student needs from me is different as a teacher. Some students need me to be hard on them. They need me to push them. Some students do not need that. And it's just gonna vary. And so this sort of demand on a field that you don't understand, that you're also not even interested in, which that's a whole other separate soapbox of mine.
right. That's the thing, is that I'm like extremely interested in
It shows.
medicine.
It shows in how you speak about it.
Yeah.
That you find this fascinating, and it's a thing that I'm sorry, but here we fucking go. So something that would really, really just drives me insane. It hasn't happened in a while because these motherfuckers have other things to talk about. So they're not fucking talking about quantum mechanics anymore because they don't want to give science any +1 points. Because then they might have to give biochemistry or medicine some +1 points. But I would get so goddamn frustrated because people will find out that I have a physics degree, and they want to come and talk to me about some fucking YouTube videos that they watched and want to tell me about how they think they solved that wave particle duality, or want to talk to me about how, like, oh, okay, so probabilistic mechanics, that means that it's possible that a pink elephant could appear right now in this room. Like, that's not what that fucking means. And then you try to explain it, and this is what's so frustrating about it. Like, I was interested enough in physics to goddamn go into debt and fucking study this shit for 5 years. You're not interested in it. You were interested in it to watch a YouTube video, feel special, and now you want to fucking come at me with all this bullshit. And you're not even interested in it. You're not interested in science. You're interested in scientists being wrong. And fuck you. And sorry.
No, that is a very interesting thing that has happened with like YouTube videos, for example, where something that you need a lot of.
Are you coming back?
Guess you'll find out. Yes, I am.
Something that you need something that complicated that you need a lot of context for. You need a lot
years of context.
A lot, a ton, a shitload of what's the word, pre-knowledge of, I guess,
right,
prior knowledge of,
sure,
to be able to understand and actually have coherent opinions about something like that can be presented to you in a way that makes it more interesting than sitting through those years and years of courses and books, and maybe in a way that's slightly more digestible, but that doesn't mean that you understand it.
Right. And that was actually something that I realized when I was giving presentations, when I was presenting my research around, was I realized that my job was not to teach people. My job was to make people feel as though they had learned.
Your job from your perspective or from the administration's perspective?
I'm just talking about. I'm not talking about my job as a teacher. I'm talking about whenever when you are trying to give a good presentation.
Mm-hmm.
So I'm at a conference and I'm presenting my research to
Okay.
non-physicists.
Okay, I got you.
I don't need to teach them physics. I need to make them feel as though they've learned. I need to make them walk away from that going like, I felt like I understood. Oh, okay. Because I just want them to think that I'm a really good speaker. I just want them to be really,
Right.
I just want them to think that I'm a good edutainer. You know what I mean? I want them to be impressed by me. I want them to have enjoyed that time.
Thanks for coming to my TED Talk.
Right. Exactly. Exactly. I'm not trying to change. I'm not trying to like really teach them.
You're not trying to recruit and bolster the ranks of physics academia.
Right. I mean, because if that was the case, then it would be like, all right, well, fuck my research. Now that I have y'all here, I'm really going to, I really want to make sure everyone understands light and electromagnetic waves, because I want you to understand that X-rays and microwaves and gamma rays and the light in the visible spectrum and infrared and all that radio waves, that it's all the same shit. And so fuck my research. That's not important. You're not going to understand. You're not going to care anyway. But if y'all walk out of here with this one, I'm going to take 15 minutes. And we're going to walk out of here and everyone's going to really own this, then you're not going to be able to be tricked by people slinging conspiracies about 5G.
Right.
Because you're going to understand that you're constantly bathed in electromagnetic radiation.
Yes.
Because anything that has temperature emits radioactive radiation, emits radiation in the electromagnetic spectrum. You just can't see it because our eyes can only see in the visible spectrum. It's a tiny piece. But anyway.
So when you get a song stuck in your head, it's because the radio waves are coming through your mind.
And vibrating.
Right, yeah.
Vibrating your brainicles. So, but that whole thing, right, of...
And I say this as somebody who watches a shitload of those types of videos on YouTube.
Yeah.
But I understand that isn't the entirety of that subject.
Exactly. Yeah. You're not an authority on it now.
Right.
Like you don't, you know what I mean? And especially, I mean, this is true across all disciplines. Because there's a language of principles. There's a language of concepts that you have to be able to speak. It's a little more explicit in physics because you have to be able to, because the way that the knowledge of physics is conveyed is through the language of mathematics. And you can't fucking talk mathematics. Like you have, like, you can't, it doesn't work that way. That is a visual, and so you're not going to be able to, any understanding you have of physics that doesn't involve mathematics is like secondary. It's tertiary. It's interpreting, it's reading a review of the music instead of listening to the music.
I like that.
So if you have only ever listened to things about physics, but you've never dug into the mathematics of it, that's kind of like only reading record reviews or only listening to record reviews and never listening to the music. So, but all that to wrap that up, like this idea of being like, you're not interested in science. You're not interested in these concepts. You're not interested in biology. You're not interested in how this fucking, how our bodies work, and how these chemicals interact with our biology. You're not interested in that. You're just interested in people that you've been told to listen to being wrong. It's just about taking a hierarchy and flipping it upside down. You still believe in hierarchies. You just want to flip it upside down, Anyway, I got on my soapbox. So,
People like to be contrarian.
I guess that's one way to say it
People
to.
do like that.
So,
They think they're special.
yeah. So, anyway, is there anything else anyone wants to add? You got something?
I got all kinds of stuff, but we ain't got time for that.
We'll pick one of them.
We just no, we're good. We're good.
Yeah, I'm gonna make you pick one. I'd make you pick a thing. Or were you making a joke?
Yes.
Oh, okay. Oh, you're lying to me. I can't.
A little of both. I don't even know
He's so
anymore.
wily, Robert. You can't pin him down.
Trickster.
Yeah, you can't pin him down. All right. Well, if no one has any other
Any objections?
overruled, over-ruled.
Just get vaccinated, and if you if you're worried or you have questions, then I don't know, fucking talk to your doctor or call me, text me, hit me up. I in all seriousness though, if you actually have like a legitimate concern or a worry, if you're pregnant, if you're trying to conceive, if you're immunocompromised, if you have had bad reactions to vaccines before, I have a lot of good resources to share with you. So if anybody is listening to this that has made it this far in and hasn't turned me off, I really will help. If you have real questions, if you want to fight, then fucking go pound your head into the pavement.
All right, guys. Adios.
Perfect.